Hey, how you doing? So who here had a vaginal delivery? Well, I didn't really have a vaginal delivery, I had a C-section, but I'm sure a lot of you out there did have vaginal deliveries. Congratulations, you did it. That's amazing. You're a trooper. Who remembers what your doctor told you about vaginal delivery recovery? Not as many hands go up. I see that. I know in the hospital it's tough to remember. The doctor goes over a million different things. You've got your baby you're juggling, you're exhausted, you're hurting. Who can remember what the doctor tells you about what to anticipate when you get home from the hospital, or even what to anticipate when you're at the hospital? So today's video is all about vaginal delivery recovery. I am Dr. Megan Gray. I'm a board-certified OBGYN and mother of 2 littles. I unfortunately can't say that I had a vaginal delivery. I did have contractions, but I did not successfully have a vaginal delivery. I got to about 7 centimeters and my cervix decided, we're not going any further. So ended up with a C-section for my first baby and decided don't want to try it again. So I had a C-section for my second baby. So, but I do deliver lots of babies. I've delivered thousands of babies. So I know a lot about the vaginal delivery process, and I know about the vaginal delivery recovery. So today I want to go over all of the do's and don'ts of the vaginal delivery recovery and what you can expect, what is normal, what's not normal, when you need to call your doctor or your midwife, and what you can manage at home. So stay tuned. So first things first, ladies, you're gonna be in pain. You just had a baby with the head the size of a bowling ball come out of a hole the size of a tennis ball. It is gonna be sore. I tell all of my patients, it's gonna feel like you've been riding a horse for the past 3 weeks. You're gonna wanna walk with your legs wide open. You're probably gonna be a little swollen, and it's gonna be very tender. Best treatment for that discomfort? Ice packs, yay! You can make those at home. Take a Ziploc bag, fill it with ice, wrap it in a t-shirt and put it up against the vaginal area. Or you can actually take a diaper and cut off the top of the diaper, stuff it with some ice and place it up against the vaginal area. You want to leave it there for about 15-20 minutes, no more than that. Then take it off. You can do that several times a day. It helps to decrease the inflammation and also helps with pain. 2 other things to use for discomfort medications, ibuprofen and Tylenol. If you're able to take those are the best medications for pain in the vaginal area after a vaginal delivery. Another option is the sitz bath. It's a tiny little basin that you fill up a couple inches of lukewarm tap water and then sit in it for 10-15 minutes, get up, dry off with a towel, or take the hair dryer on the cold setting and dry. Make sure when you're drying with the towel, you are patting dry, not rubbing. Do not rub. That hurts. It will hurt, I promise. So pat dry, and that will help with the discomfort in the vaginal area after a vaginal delivery. Something else to expect after a vaginal delivery: vaginal bleeding. That blood has to go somewhere. It comes out. The lining of the uterus will shed. All that lining that was used to help support the placenta will start to shed after delivery, and it may take several weeks for it to fully shed. So you can expect to have vaginal bleeding. Most women are going to have bleeding like a period, maybe a little greater. Some women have lighter. You can expect even sometimes to have some clots. The clots should not be huge. They are going to be maybe dime size, quarter size, $50 size. If you're noticing bleeding that is greater than that, so you're having golf ball size clots or baseball size clots, or if you're saturating a pad an hour or more, that is abnormal. It needs to be evaluated, so you need to tell your midwife or your physician. So what do I mean by a saturated pad? I get that question all the time. So this is my son's paint, not blood. So this is an example of a fully saturated pad. This is a giant pad, fully saturated. If you are changing pads every hour because it looks like this, that is too much bleeding. You need to be evaluated. Or if you're passing clots the size of a golf ball or greater, you need to be seen. It needs to be evaluated. Do not go home bleeding this much without your physician or your midwife knowing. This is normal. That's a normal looking pad, very normal. It will resolve. over time. Even if you're having to change every hour and it looks like this is completely normal. It's okay. So you can rest assured that this kind of bleeding is okay. Once you get home, you can expect the bleeding to decrease day by day. You should notice that the bleeding improves. You may notice that the bleeding changes colors as well. The first couple days after delivery, it may be bright red, and then it will change to a very dark red, then maybe more of a brownish color, and then a browny yellow color until it completely resolves. It may take several weeks for the blood to completely resolve. Some women will have bleeding for a couple days and it will go away completely. Some women will have bleeding for maybe 2-3 weeks. They'll have average amount of bleeding first, and then they'll start spotting, and then it'll completely go away. Some women will have bleeding, it'll stop. Then they'll have a little bit more bleeding, it'll stop, and then they'll have spotting, and then eventually will stop. Usually with 4 weeks out, it's pretty much stopped. Everyone's a little bit different. If you're having bleeding like a period still and you're 3 to 4 weeks out from delivery and it's still like a full period, that needs to be evaluated. You're probably bleeding a little too much that far out from a vaginal delivery. Another thing to expect after a vaginal delivery is uterine cramping. Those cramps, those contractions don't go away right after delivery. In fact, we make you contract more after delivery. We give you more Pitocin through the IV to keep the uterus contracting so that you don't bleed too heavily. So expect some uterine contracting. It may just feel like period cramps. It may be in the front, maybe in the back, or it may actually feel like contractions. A lot of my patients will say, holy cow, why am I still contracting? The baby and the placenta are out. What is going on? That is normal. That is your body's response to the hormones that your body is producing after delivery, especially if you're breastfeeding, to keep that uterus contracting and to push out any blood clots, tissue that may still be stuck inside that uterus. You may notice that the uterine contractions or cramping increase around the time of breastfeeding and right after. Completely normal. That's your body's producing oxytocin with breastfeeding, tells the uterus to contract. Very normal. You will notice that discomfort will dissipate over the next 48-72 hours after delivery, to the point where you start breastfeeding, you will no longer feel that cramping or contractions. It's really the first several days after delivery that you'll feel it, and then it will completely go. Another common complaint after a vaginal delivery, rectal pain. Okay, the rectum is right near the vagina. They're all right together, right next to each other. So as the head comes out, not only does it hit the bladder and go through the vagina, but also hits the rectum. So the rectum can feel like you still have stool in the rectum. It can feel bruised just like the vagina does. Completely normal. Same thing applies here. You can use ice packs, sitz baths, ibuprofen, Tylenol. Those will all help with that rectal discomfort. You may notice hemorrhoids after a vaginal delivery, especially if you push for a long time or if you already had hemorrhoids before delivery. Those hemorrhoids might have gotten worse during the pushing period. Completely normal. Usually those hemorrhoids will go away over time. You just have to give it some time. Over-the-counter medications tend to work pretty well for hemorrhoids. If you're noticing that they're not working, let your physician know. They can prescribe you a prescription medication that may work better. If you're noticing your hemorrhoid pain is getting worse instead of better, or is so painful that you can't sit down, that needs to be evaluated. Just let your physician know so they can get you to the right person after they evaluate you. So let's talk about a couple of the do's and don'ts after a vaginal delivery. So do ice the perineum. You can do that several times a day, 10 to 15 minutes at a time. Don't put the ice directly against your vaginal area. That will hurt. It'll burn the skin, so not worth it. Wrap it in a t-shirt or put it in a diaper. Just don't put the ice directly against the vaginal tissue. Number 2, do use a perineal bottle. They are fantastic, an excellent way to keep the vaginal area clean. Do not fill it with hot water, lukewarm water only. You do not need soap, just water. Just fill it up fully. In the shower, take it, spray as much as you want down there. You can do it all day long if you want. It's not going to hurt anything. If you start adding soap, it's going to dry out that tissue, and that will hurt over time. So that would be like the equivalent of you taking a bar of soap and washing the inside of your mouth out. Ow. Will start to crack, become painful. Don't do it. Just water. That's enough. Number 3, do try sitz baths. get a sitz bath basin. You can get that at any drugstore or medical supply store. You can get it on Amazon. Fill it up with a couple inches of lukewarm water. Sit down in it for 10-15 minutes. When you get up, pat dry with clean dry towel. Remember, don't rub. Or take the hairdryer in the cool setting, not the hot setting, the cool setting. You don't want to burn anything down there. And then dry well. Don't get in your bathtub. It's dirty. You're sitting in dirty water. We don't want all that dirt to get up in the vagina, near the cervix. It could cause an infection in the uterus. It could cause an infection if you have any tears of the vagina that are trying to heal. So avoid the bathtub. It's hard to get clean. Use the sitz bath. That's easy to clean in between uses. That's the best way to keep that area clean. Do take showers. Showers are fine. Once again, use that perineal bottle. Fill it up with some lukewarm water. Spray the vaginal area to keep it clean. Or if you have a handheld shower, that's a great way, a great alternative to spray down there. But don't sit in a bathtub. No sitting in or waiting in hot tubs, lake water, beach water, swimming pools for at least 6 weeks. So showers only for 6 weeks. Avoid hot tub, swimming pool, lake water, beach water for 6 weeks. Finally, my biggest don't after a vaginal delivery, don't put anything in the vagina. Ladies, that means no fingers, tongues, toys, penises, tampons, douches, nothing in the vagina for 6 weeks. You don't want to mess anything up down there. Let it all heal. You may have some tears that had to be repaired. You don't want to disrupt those stitches. You don't want to cause an infection. So don't disrupt the natural flora down there. Let it heal itself. The vagina has a fantastic ability to heal itself and to keep itself clean. We don't want to mess that up. So keep everything out of the vagina. So that covers it for the basic things to expect after a vaginal delivery, the most common questions that I get asked, and the most common anticipatory guidance that I give my patients after delivery. Certainly, if you have any questions, feel free to contact your physician, your midwife, or you can ask them down below. I'd love to hear from you. Once again, this is the Forgotten Trimester. All the information that is discussed on this channel is for educational purposes only. It is not to be used for diagnosis or treatment of any problems. I am so proud of you for having a vaginal delivery. I wish you the best of luck in the 4th trimester. Please stay tuned for subsequent episodes. I do plan to have some information specifically on vaginal tears, breastfeeding, vaginal odor. So please stay tuned. Lots more to talk about. I wish you the best of luck. Thank you so much for your time. Bye-bye, ladies.